Learn to Be is based on 3 themes, which are creative expression, healthy living and well-being. Working in partnership with adult education means that we've been able to develop more of a range of courses than we used to offer as a service ourselves. It's enabled us to normalise people's experiences more because they're advertised in the adult education prospectus. It's not badged as health or mental health, and it's much more acceptable for people to come along to a community venue and do an adult learning course.
It's just such a positive thing to do, and it just creates a bit of happiness, and sometimes it's a diversion from things that happen in life.
In the beginning, it was just a way to stop my brain from going on chattering.
Everything else can just melt down and calm down because I'm concentrating on that and getting absorbed.
Aside from the clinically significant outcomes, there's lots of softer outcomes.
As well as doing the art, you get to meet people as well, people that you wouldn't normally mix with.
I was shut off, I couldn't go out anywhere, and this has been a lifeline to me.
The Wellbeing Service provides a service for people with what we call common mental health problems. So that would be anxiety, depression. People can come to us who are feeling that kind of life's problematic for them. We provide therapists in the GP surgeries.
So there is a wellbeing worker in all 84 practices in the Northamptonshire county. And their first initial appointment with us is an hour, so they have a lot of opportunity to really tell in their own words what's actually brought them to see their wellbeing worker today.
At the end of the appointment, we give them a choice, things like art therapy, or some people will offer one-to-one guided self-help. And we give them a whole raft of choices, and then they choose the way they would like to work towards their recovery.
A service that talks about people in their entirety and talks about them as a person rather than as a set of symptoms is really important, and is where mental health services should be.
It's an area of real need, and it's an area that has been neglected, so it's great to see a service that's actually doing something that we've been crying out for, and finally we've got.
Normally when people come into hospital, they're treated for their physical illness and their mental health is secondary. It's almost in a way not considered, even though it is still in the background. At this ward, however, we treat both as equal.
It's a 28-bedded ward, and then we have a large day room, dining room in the middle, where we aim to bring patients together for activities and social occasions, eat the meals together, make it more normal, more like a home environment. The whole ethos of this ward is that we have general nurses and mental health nurses working alongside each other on a day-to-day basis, learning skills from each other. It's still early days of the trial, but I think we all believe that it's going really very well, and we get a lot more patients discharged back to their own home.
We treat people as an individual, not just as they've got an illness.
To make sure that the patient's whole well-being is taken care of.